All right, hello and welcome. I am super excited here to be at Functional Medicine Idaho for a really transformational conversation. We have with me today, we have Amber Warren, who's one of the founders of Functional Medicine Idaho, and Tamara Garrick. We've just been here today filming, but I also have super excited with me Paulette Jordan, who is the future U.S. Senator for the state of Idaho. Isn't that right, Paulette? Mm-hmm. So, Paulette, I want to start with you. It's just that you have a really unique vision for the transformation of healthcare, something that I've never heard any other politician speak about. So, where did that vision come from, and what is that vision?
I would say, it started when I was a kid. My grandmother is a medicine woman, and I was raised up with cultivating our land. And as we're cultivating the land, it's really unique because I didn't realize that this was a practice that we had, in being out in farmlands, because we're Idaho, we're a very big ag state. And my family, who's a farming family as well, it just becomes one of the practices that you inherit in your tradition. And so I grew up on that lifestyle, and that just became part of my upbringing. As my family or my relatives have gone off to medical school, I've learned that, we're not exactly teaching functional medicine in medical school. And my uncle, who is more traditional, but yet learning the Western medicine practice, they weren't meshing very well. And then as we see society now growing to having to deal with all the pesticides, the chemicals that go into our crops, which is our nutritional health and natural living, and then getting into technology of today and how it's impacting our kids, it just has this mass effect. And by the way, I'm also a businesswoman, and I definitely look at the budgets and where we're expending our resources. And then getting into politics, it really changed my thinking towards healthcare. As we have a state now that, we just expanded healthcare to people who couldn't afford it. But this is an area where I feel that it shouldn't come down to money. It should come down to how we access foods and grow our foods. And I want us to, have our elders and people live good, long lives, and children to be able to grow up without all of the, these chronic conditions. And then when I started looking at, how we operate through the government system and how healthcare is overrun by the government burdening our healthcare, and of course, getting into our daily lives, I thought there's a better way. And of course, I brought in a healthcare advisor who has worked at the national level with developing the fiduciary trust agreements through the Pentagon and working with the SEC. And as things started to evolve, then I ran for governor in 2018. I really started taking a deeper dive into healthcare in this country, learning that we expend nearly $3 trillion a year, $2.9 trillion, in fact, on chronic health care. And this, in fact, really deeply impacts our rural communities, especially those like mine, because we have more people who are dying of cancer or diabetes or just plagued with these chronic illnesses. And I thought there has to be a better way. But we are operating our local clinic, Merriman Health, through chiropractic care, and we're using physical therapy and laser treatments. We're trying to do our best to integrate all these different types of functional medicines into our community, which is very rural, but I'm seeing how effective that is. And I thought, well, why can't this be implemented throughout our state, and why not the entire country? But it really is going to take a matter of all of us looking at the studies and the reports from the CDC to the National Institute of Health and what they're offering. And they're all saying that we are just generally not utilizing the data. And we're not collecting any data. And if we're not collecting the data, then we're not really operating off of a model or a method that's going to help move our country forward to truly address the root problem that we're all facing. And as we're working against the corporations in this regard, because again, it does go down to our foods and our water and our soil health, then how do we truly fix this problem? But for my generation, I am excited because we're mobilized through action. And this is one of the reasons why I'm running for U.S. Senate, because we have an opportunity in this day and age, and also because we're facing COVID and people are more mindful of their health. I really do believe that this is going to be one of those top priorities or issues in this country that people want to address. Aside from the financial crisis we're in, it's going to come down to how do we address the healthcare crisis that we're in. And I truly believe that functional and integrative medicine is the way forward.
Absolutely. Well, I want to come back to COVID in a minute and that conversation, but part of why I wanted to get all of us here together was because I see what's happening here at Functional Medicine Idaho as a sort of a workable model to show how we can reverse chronic illness and get people off medication at scale. And I don't think that there aren't that many great examples of this in the country yet. We're working on building that ecosystem. So you just took the tour. What did you learn on the tour, and what do you think about what these guys are doing here?
Well, uber exciting, what the folks here are doing. And of course, I was so impressed that we have it here in Idaho. When I learned that there aren't many functional medicine clinics here in this country, I thought, oh, we have to have more. So I'm hoping they're looking at what you're doing in this, and it's groundbreaking. But to see that you were able to take in a potential patient and assess them right off the back, and doing so, knowing that for free. I mean, you said it's at no cost to the patient. I thought amazing. And then, of course, being able to follow through, having a full history of their background, and doing so with utmost sincerity. And that is missing, that true compassion, that love and care for people. That is missing not only in politics, but it's missing in medicine today. It's so transactional. And you go to a hospital, it's very cold, and no wonder why nobody wants to go to hospitals, and that they'll wait for a life-threatening condition to hit them before they go see an actual doctor. But it's nice to come here and be so warmly welcomed, and having that kind of intake is very unique but very special. And I'm hoping that once people see this video, they'll see that it's not only accessible, but that you are truly looking to address the root problem of their issue, and of course looking at all the methods and models that are out there. But I just love that you are wanting to address this yourself. You said, I will go through their file at night before I see them. And that to me says a lot about you and your facility. And this is the model I want to see more of.
That's, Amber, just to give a little context, you worked in rheumatology for a long time, and rheumatology is just a sort of a microcosm because the drugs are super expensive.
Right.
The number of people on those drugs is going up all the time. And, now you've sort of brought a functional medicine approach to a regular rheumatology clinic and now got to design care from scratch here. Paulette's saying we should sort of scrap it and start again with functional medicine. As someone who's been on both sides of just rheumatology, how would you think that approach could work?
I mean, root cause medicine, right? I saw a clinic and I witnessed how we weren't applying root cause medicine to what we were doing. We were using Band-Aids. And the Band-Aids I was using happened to be really toxic and really expensive Band-Aids. We're talking sometimes $25,000 to $30,000 a month for some of these intravenous medications. And so I saw how we were failing these chronic diseases and these patients that were dealing with debilitating chronic diseases. And it didn't take a lot. I did a lot of kind of self-learning and self-education, learning a little bit more about nutrition specific to gut health and specific to autoimmune conditions. And it wasn't like I was making these patients do monumental things and climb mountains. I was asking them to read food labels and watch sugar intake and just be more aware of what they're putting into their body and what kind of environment they're living in, right? What kind of air they're breathing and their stresses and how their sleep was. Not just are you getting enough sleep, but are you waking up feeling rested? So it was really the basic things that we now have health coaches and nutritionists doing for us so we can focus on the higher level, functional medicine. But it was really the exploration of gut health and starting to learn about where the majority of the immune system lives that I just realized I couldn't keep putting toxic Band-Aids on people. And I really wanted to establish root cause, whether it was a food sensitivity, whether it was an overgrowth of detrimental bacteria in the gut, or pesticides and toxins like you spoke of, or stress. So many patients, a stressful event was the triggering event that broke, that broke their body and allowed this autoimmune disease to come with a roar.
Absolutely. And Tamara, just, I know that you sort of hedge both worlds and the fact that you're a nurse, but you're also involved in like the clinical operations here. One of the things that is super, because functional medicine is reversing chronic illness and getting people off drugs across the country. But there are some unique things about what you guys are doing here at Functional Medicine Idaho, particularly with insurance reimbursement and particularly with group delivered care that you're doing. Can you just share a little bit for Paulette and for us, like what are some of those things you're doing and what's made the biggest impact in making this accessible now?
I think accessibility is huge for sure. Scalability, being able to see more patients in a model that they get together and learn from each other too. They can learn a lot in an appointment with Amber or the physician or one of our other providers, but when they get together and they realize, I'm sitting in the room with 4 other people who have the same experiences, who are going through the same thing, I think their knowledge just increases so much by experience. So I think what we're doing with our groups and our shared medical visits is significant and kind of the foundation of what we're doing. I think another really big component is education. In the conventional medical model, education is part of our scope of work, but yet we don't get the time to do that, right? Billing insurance, it's very difficult. Or it's, here's a handout, or here, check out this resource. We have a team here who can facilitate all that. And what we found, I think, as a team, and everybody would agree, is that our patients who are educated and who understand a little bit more about what's going on with their body, what's going on around their body, are more engaged, more compliant, or those are the ones that we see outcomes increase significantly.
Well, and those are the ones that tell their friends, right? And that's how they get our message to the masses within our world. Because at the end of the day, not everyone's going to hear of this kind of medicine and engage with us and come and see us. But if they can hear how changing their diet or changing their lifestyle or finding out that there was a heavy metal that was taking over their body, if they hear those stories, that encourages them to make some of these changes. And then we all save healthcare dollars and we all recover from a pandemic much more successfully, right?
And it's not easy to make those changes or to modify behavior. I mean, gosh, people go to school and study that forever. Why haven't we all figured it out? Everyone, we've studied it, we know how to do it, but it takes a team and it takes a collaborative care team. And so our team, our nutritionists, our coaches, it's where the rubber hits the road. I say it over and over, that they sit and they say, okay, it was overwhelming. You met with your provider and they want you to sleep and get acupuncture and meditate and eat more vegetables. Let's start with one thing. And our coach walks them through the steps. And I think the feedback we get from patients, so we do one-on-one like lifestyle appointments, nutrition. Our small shared medical are typically 3 to 5 patients. And then our groups are larger, so up to 20 people. We run series, we run intensives, which are 5 weeks, which are really the 5-week programs. That's where the change happens because they have the accountability, they have the support.
They check in with someone every week, sometimes twice a week. We can offer that accountability. I don't have time to be someone's accountability partner, but we have a health coach that does.
Yeah.
Paulette, from everything from your cultural context, I guess it's not that much of a surprise that community heals.
No, and it's so beautiful to hear that you're bringing community together in this way. So yes, I'd say this is how it works. But I did want to also harp on the one fact that you talked about in the beginning of the tour, which is that, for me, when I see someone who says, I truly care about the patient, I'm going to go home, take their file, assess it, and then I'll meet with them the next day. That to me says that it's not about the money for you. Yeah. That it's all about truly loving and caring for your patient. Yeah. And while that's rare, it is also what is missing in the entire health industry in today's day and age, especially when we talk about pharmaceuticals. Right. And from our community, we've been heavily impacted by the opioid industry, which is why we're also tackling them in this national lawsuit to give us our money back, because you've taken so much as not just money, but lives. Right. And every day I hear another story where someone has overdosed on opioids. That breaks my heart, because these are folks who are very close to home. They're in our rural communities. They're our neighbors, family, and friends. But knowing that this level of medicine, and it's not replacing the entire healthcare industry, but it's integrative. So people can opt for another way of doing things, which is what I like, because we're given choice. So this is another choice. And I think now that people see it's more available and accessible, this is a much better choice. So seeing this integrated more to our common facilities or hospitals would be amazing. This is the future of medicine that I see.
Absolutely.
Well, and it's upstream, right? So we're catching things way up, whereas our hospitals and conventional system they do a great job at acute care, surgery, emergency care, definitely needed. But where I think we thrive is meeting our patient before that. So if they do need to go down that road, how do we help decrease inflammation? How do we educate them on modifiable lifestyle factors? How do we work with them to get them to optimal health? And then, things happen, but they don't always have to happen. So, I don't know, it's exciting. It's really, as a nurse, it was really frustrating in the hospital system to see so many patients just medication after medication after medication and not have the time to educate. And I worked in a rehab hospital, ortho neuro, and I said, oh gosh, I wish I would have seen you as a nutritionist at Functional Medicine of Idaho, just because what we do definitely changes lives.
Well,
but
we
not
want to
only
hear
that, but saving on bills and keeping people from being evicted. I mean, if most people here in Idaho, when they come to me when I'm running, and I'm their representative, and they will say, you know, I had to choose between having a home or going homeless for the prescription drugs that I wanted or needed. And having to choose between your home and healthcare is huge. And if you're able to save people some money and they have money to pay for their bills, that is great. And I think that's why, you know, you are to be highly commended, because you're not only saving money, but you're saving lives at the same time.
I think the gold standard of what we're looking for is this idea in healthcare of the triple aim, right? Which is better outcomes for patients, better experience for being a physician in the system, and lower costs. And you know, from one of the things that I've seen, the question we'd have to ask is, well, why don't doctors care enough to do the work ahead of time between things? It's really because burnout, which is actually moral injury. Right, and there's studies showing it's real moral injury. Like, doctors are being morally injured by the fact that they just have to put people on drugs and they don't really have time to do anything else, and the system is pushing them to do those kind of things. And there's new science that came out that I just heard about last week that says that if a doctor spends 20%, just a fifth of their time doing life-affirming work, the burnout rate basically goes to zero. And from what I heard from Dr. Holthouse, who's the medical director here earlier, that, you know, doing these groups and seeing groups of people supporting each other to get better is like the most affirming, life-affirming medicine there is. Seeing people get off medication, seeing people not have to make these kind of choices that you're talking about is really wild. So I think that there's so much happening there. I want to talk about COVID for a minute, because obviously it's the hottest topic in the world. Just today, while we're sitting here, and you guys may not even know this because I was looking on my phone, but just today, a study came out from Stanford showing they now understand the mechanism by which some people get like mild cases of COVID and some people get really bad cases of COVID. And guess what it is? It's leaky gut. And this is like the center of the functional medicine operating system, is the integrity of the gut lining. And that gut lining can get destroyed from pesticides and food and stress and all these other things that contribute to it. But they found that these like microbes were getting into the wrong part of the body and being moved around into the circulatory system. So, you know, one of the things that's really interesting about that is that, first of all, and in the study they said, well, no one knows why people are getting, you know, these range of outcomes with the same people, but we know why, right?
We know why.
Yeah. So do you want to just share a little bit about that? Because I just feel like this is, you know, Functional Medicine 101, and I held a webinar on April the 8th, I think, where it was perfectly laid out. Like, these people get it seriously, these people don't, and here are the different mechanisms why. And I just feel like, as I read this today, I was like, this might be like our moment, you know? And it might be a moment for politicians to be able to stand up in the truth of what they've been saying for a long time and say, look, this is a national issue that's happening, and the solutions are right here. We just have to know where to look.
Well, we know the comorbidities that it put people at an increased risk from dying or having, you know, getting really ill from COVID are diseases at which the body's in an increased state of inflammation, right? So that study was a perfect example. If we can work to get individuals' inflammation down, a lot of times we kind of jokingly, but also seriously call ourselves inflammologists, right? We're really just trying to attack inflammation within the body, using our resources, using our tools, using our training. And so I think when we're focusing on gut health, that's where 70% of the immune system lives. So if we're dealing with a virus in which we don't have a treatment, how could we not focus on a place in which the majority of the immune system lives? You know, we've got trillions and trillions of microbes that outnumber our cells. Some people will say, you know, 1,000 to 1. And most of them are beneficial, and most of them help bring improved immunity to our system. And we live in a world where we seek and destroy and we attack bad microbes, but we forget that there's really good microbes that improve immunity and decrease inflammation. And so what we're really trying to do is encourage our patients to think about gut health and think about not just how food impacts inflammation and driving inflammation in the body, but how again, toxins and what your, you know, stressors. Are you up late reading the news and listening to what the media is telling you and playing into a lot of the fear that's out there? Are you looking at your body thinking, what can I do to improve my immune system and decrease inflammation so I'm not another statistic out there from COVID? So again, it's really trying to give our patients the tools so they don't have to walk around being scared, and they know they have control. They know that within 48 hours of changing their diet, they can decrease type 2 diabetes. They can just make it go away, which dramatically decreases your risk of dying from this virus.
Amen. Yeah.
Do you think this could help you be more effective on the campaign trail, Paulette, in the next 2.5
I always
months?
say absolutely. Anytime you have science or data on your side, and a lot of people listening right now, they want to know, what else is out there, because if there's not a vaccine, and if there are even a lot of anti-vaccinators here in our state, but a lot of us who are independent and rural in our state like ours, they think like I do. We believe in our sovereignty. Body sovereignty is huge, and food sovereignty is huge. So food sovereignty really has a role right now, because we're talking about growing our own foods and having our own gardens. And now that people are dealing with COVID, they're staying isolated in their homes. So I'm hearing more about people growing their own foods, having their own garden beds. And it's fascinating to see people get back to that, because we stopped teaching it in schools. But now, maybe that'll get reintegrated back in the schools, and more families will grow their own foods. And then we'll eat healthily again. But it's nice to see people growing their own foods and making their own meals with those natural foods. And I think even farmers will find their right place and shift. And this is why I talk about ag tech. But I think then, farmers will also come into this role where they're able to focus on soil nutrition and of course being able to grow these crops without all of these pesticides, and having so much to do with the corporations that come into our state now, like Monsanto and Bayer. But I think it's just going to really change the entire game and the way people look at not only healthcare, but food and agriculture in the future.
Well, and we get our patients and we get the communities out there interacting with nature. When they're out there gardening, they're interacting with dirt, which we know helps to inoculate the microbiome and improve immunity. And we're getting them away from off the couch, and we're getting them moving and getting them engaging as a family, which is so important. Again, it comes back to community.
And that's why I thought your platform is just so unique, because you're talking about health and you're talking about agriculture, and anyone who's in this world and is reversing chronic illness. And, I know that you were recently on Dr. Hyman's podcast. He wrote a whole book called Food Fix, because he realizes we're going to have to go that far upstream, right? If we're going to really deal with the issue. And I almost feel like your campaign for me is kind of like functional medicine for politics, because it's getting to the root cause of the issue. And that ultimately, if you're just talking about who's going to pay for the medicine, and you're just going to talk about we need farmers to be whatever the mainstream idea of what agricultural policy is. When I saw the different areas of the policy, I thought, look, this is well thought through, and it's in anyone who's in our world, who's on the front lines of care trying to reverse chronic disease, realizes that we need a fix of that sort of elegance and magnitude in order to solve this problem.
Yes, thank you. And it's very complex. I think in today's day and age, the political system is so divided, and because it's so polarized between the right and the left. It does really give us a place as far as being from Idaho, being rural, being indigenous, and a woman. And women, we are naturally caretakers of not only the people, but from my culture, being indigenous, we're caretakers of the land.
Right.
And so we think about the next 7 generations, not for ourselves, not for corporations. We think for everybody. So for the land, which is nature, and for humanity overall. And I think this is why the country is looking for leadership like ours to bring the country back together, because they're seeing that there is a better way forward.
Well, I think just even in here in Idaho, that's traditionally been a red state. Some of those conversations about body sovereignty, these have been things that typically, people who vote Republican have been really, cared about and have maybe voted in that direction just before. So, I was excited to hear you saying that, because I don't hear that from the Democrats in my state, California, and I think that, this whole health issue and COVID and all the things that we're seeing is seeing that this has to be something that we have to, take on head on, because ultimately, like, healthcare and food is what's making us sick. It's not actually facilitating, health across the population. So,
which are the two things that are supposed to make us well, right? Healthcare and food. And I think, sorry, this is all so exciting, but like the nourishment component and getting back to our roots, right? So like Amber said, what is nourishment, right? It's definitely not just healthcare system. It's food, it's what's around us, it's our relationships, it's when we go to work every day and take care of each other. And I think we're missing that. We're missing such a big part of that. And with functional medicine, we get to do that every single day. And we get to work with our community, our patients. And it's amazing that we're doing it in Idaho. I mean, I've only been here 3 years, and it's like, it couldn't have been a better place, and a better place to even kind of birth functional medicine out here in the Pacific Northwest.
One of the things I heard in the interviews earlier today from the people, some who are from Idaho and some people who have just moved to Idaho, is they feel like even actually specifically here in Boise, there is an energy about this medicine that is not happening. And Mark Holthouse, who's the medical director, he came from California, which is like where this all began. He said the energy of what he's feeling here and just speaking to people out on hiking trails or otherwise, like he feels like this could be, a birthing place for a health revolution in this country. And, I think that, we might have to, back the politicians that want to see that too, right?
Absolutely. I hope so.
Well, it's been a wonderful conversation. Thanks for hosting us here, Amber and Tamara, and I'm really excited to share this out with our community. And to Paulette, I just want to when I saw your campaign and we did that first interview, the first thing is I wanted to just find as many ways as possible for people to find out about this. I think for integrative and functional medicine practitioners, whether you're in Idaho or otherwise, like here's a way that you can hold your delegates and your senses to a new kind of standard. And if you look at Paulette's website, you can see how she's talking about the kind of change that we need in healthcare. And ultimately, for people in Idaho, we have an election coming up in November, and I've never really been that excited about politics in America, but that interview that we did get me excited because I see that finally someone's developing a true plan that can take us where we want to go, and hopefully Idaho can lead the way. And I know leading the way is sort of like the core message of your campaign.
Yes, it is, absolutely. That and bringing our country back together and dealing with the financial crisis that we're in. Yeah, we have a lot of work to do.
Yep.
All right, well, this has been a special episode. We are here at Functional Medicine Idaho. Thanks so much, Paulette, Jordan, and the rest of the team from Functional Medicine Idaho for being here, and we'll see you next time.